There we go. So my role now with SCPHA is member at large. I'm helping along with Christina's helping me too to develop and launch a mentorship program. So we're really excited with that. So that was how I got introduced to Christina in the first place. And so Public Health Month is April. Typically, it's a role our vice president takes on. There was a lot of things happening personally, so some of us just kind of jumped in to see if we could pull off some activities at the last minute. So they did have a great domestic violence talk last Thursday via Zoom. So that was one of the opportunities. We have this one now, our advocacy one. And then after this, if y'all are free from 1:30 to 2:30, Elizabeth DeVeo with DHEC is doing a presentation on opioids. So definitely like feel free to check that one out too. That would be great, and that'll kind of wrap up our activities for the month. But I encourage anybody to join the Public Health Association that's not already a member. We would love to have you. These were just something we want to do just to kind of celebrate public health and all the different ways that you can do that and be involved. So I am kind of a baby to advocacy. I've learned a lot through Christina. She's probably one of my favorite people I've met in the last year. So she has taught me a ton. So it really kind of made me think, and being in the job that I am now, I actually get to see that it really does matter. So I was a community dietitian. Now I'm in has more of a clinical piece to it. And so I'm in a clinic and there's no reimbursement and billing hardly at all for dietitians in the state of South Carolina. So now I really get to see how much advocacy and how this can impact. And so it's like my staff could have full schedules, but they have patients who do not have insurance coverage for it, and they can't afford to pay out of pocket. So that was kind of like what kind of really brought me to this. So I appreciate my panel who has joined me today, and I roped them all in. So thanks for that. I'm gonna go ahead and share my screen so y'all can see our PowerPoint. Let me slide this over. See in my email. All right. And hopefully I can continue to see if I need to let people in too. Let's see. Okay, so the title was Empowering Communities, Advocating for Health Equity and Access. So I'm your moderator. Our speakers are Chandler Cox, Kate Gerweck, and Christina Picozzi. So they will go in order of their names, but one of the things that they thought would be really helpful would be to kind of kick it off with that advocacy versus lobbying discussion. And I think people are not quite sure what the difference is in each one and navigating that. So, and my panel, please feel free to chime in. But I found these couple graphics that I thought did a pretty good job kind of explaining things where your advocacy is more like raising awareness, educating, informing, maybe sharing info, gathering people, working with your communities, talking to policymakers and things. But the lobbying side of it seemed to be more vote for this, advocating for certain bills, meeting with those lawmakers, helping to write these types of papers. So that was kind of my overall understanding of the difference. Would my panel chime in anything else and elaborate on that? Not to put y'all on the spot, but
Yeah, I would. So Christina Picozzi, I use she, they pronouns. I do a lot of public health and social justice work, and I'm contracted with the Harriet Hancock LGBT Center here in Columbia. We're a 501(c)(3), and I think something that can be really scary for folks that work in the nonprofit space is really where is that line between advocacy and lobbying, because sometimes it's really just a semantics, a language piece. Advocacy can still look like going to the state house and talking with your legislator about a very specific piece of legislation and educating them around why they should vote in a certain way. I typically see this, and I will say, coming from the nonprofit space, I see the lobbying side as how active am I in getting involved in getting those pieces of legislation written and actually influencing those pieces, changing their language. That is not what I do. That is not what we do at HHC or in any of the nonprofit spaces that I take up. But that's something that I would also argue is like there's so much more advocacy that we can do, but that line can get a little confusing and it kind of scares some folks.
that's great. Thank you for chiming in. All right, Chandler, You are up. Chandler is going to talk about mental health related legislation and policy that's out there. This is just a little bit about what she is doing currently as far as who she is tied in with. Chandler, anything you want to add about yourself before you kind of launch into your spiel?
I am really grateful to be a part of this conversation. Um, I'm representing the South Carolina Counseling Association. I am currently the advocacy chair. And I've been doing advocacy work going on 2 years now, and I still learn new things every day. So it's definitely been a growing process. Um, Probably the most exhilarating slash frustrating part of what I do. So, happy to speak about this with you all today. I'm also on the Behavioral Health Coalition and the South Carolina Coalition for Safer Schools, and can talk a little bit more about that if anyone is interested in our follow-up questions. But predominantly, I want to talk to you about our legislative priorities and some of the things that we're working on right now. Um, the beginning part of the year, we were really focused on insurance. A lot of those disparities, we just got approved for Medicare coverage as of this year, which is really great. Up until then, there were no counselors that were allowed to be paneled with Medicare. So a big group of our populations, our older adults, they were having to pay out of pocket if they wanted therapy. Um, the other thing that we took on was Medicaid. So we were able to build a bridge with DHHS. If you know anything about DHHS or any of you guys are representing them, it has been kind of a puzzle over the past however long. Um, but in meeting with Director Kerr, he was really open to having conversation and talking openly with us about some of the unfair things that our behavioral health providers were facing. We were really shocked. We actually started with a petition because we didn't know, like, how big of a problem is this? And it got over 800 signatures over the course of 3 to 4 months. So a lot of our practitioners were reporting that they were being dinged on little things that weren't really having anything to do with their actual care that they were providing. And a lot of money was being recouped, and that the auditing process was not uniform. Some people would say, I had 2 days to send in my documentation. Some would say, oh, I had 3 months. There was not a lot of uniformity in that process. So we've been able to build a bridge with them, and hopefully those conversations will be ongoing. And then TRICARE. So there's a real lack of TRICARE providers in areas outside of Charleston and Columbia. I practice in the upstate in Anderson, South Carolina, and we have one TRICARE provider, and she only works with children. So really trying to get more providers panel with TRICARE so that our veterans can have access to mental health care. And then the note on medical providers is really speaking to protections from the term counselor. When you hear a counselor, that can show up in many different areas, but we're not really a protected term. So I represent licensed professional counselors. That means trained, ethical, competent clinicians. And if you have a complaint about that clinician, you can make a board complaint and there will be recourse. There are a lot of people that are practicing without a license, and there is no recourse for the public in those situations. So something that we're working on right now, trying to put it in our practice act that you cannot impersonate a behavioral health counselor, and that you should be practicing with a license, barring a few exceptions. Um, and the biggest thing right now is the counseling compact. So the compact is on the House floor right now, and hopefully will be moving this week. I'm gonna knock on anything and everything. This has been a 3-year process. There are 34 states in the compact right now. So if you are a compact state, you can practice in other compact states, which makes it a lot easier for people to have access to mental health care when they move or they travel or they're military, they get stationed elsewhere. So the access part of it is really important. Here are some pieces of legislation that we're following. Compact, the Executive Office of Health Policy, the House version actually is not moving, but the Senate version is. And that is on the floor. I think it will be debated here this week. S408 is on the House floor, has already cleared the Senate, and that is mandatory suicide prevention training as part of our continuing education requirements. And then lastly, 4624, which I think we probably, all of us panelists, even though we come from different areas, we probably all have that on our list. That goes to the last bullet point. Over the past 2 years, and maybe before then, whatever is the hot topic of the time. Last session, it was abortion. Now it's transgender rights. There's kind of an attack on clinicians that support those populations and work with those populations. The early iteration of this bill was actually trying to criminalize providers for just having gender affirming care, and the language was so broad, even calling someone by a name other than their government name could be fall under, gender affirming care, and really just a lot of ignorance in our legislators and not even knowing what this process looks like. So protection for those counselors is why we are actually opposing H4624. For many reasons we're opposing it, but from a counseling perspective, that's why. And that's it. That's all I have.
Great. Thanks so much, Chandler. So Chandler's kind of setting the stage with our mental health related needs. We'll roll into Kate to talk about nutrition, and we'll wrap up with Christina with social justice related needs and priorities. And then we'll have time at the end for questions. So just kind of setting the stage for everybody. So Kate, if you are ready.
I am. Well, good afternoon. My name is Kate Gerweck. I also am a registered dietitian. I am the Director of Public Health Nutrition Practice and SNAP Education at DHEC. Today, I do not have specific legislation that I am highlighting. Unfortunately, there are no current bills within the legislative body. There were at the beginning of this year in regards to the summer EBT program. But today I would like to highlight 2 recommendations that were provided to the legislator from the Food Security Council that was established last summer as a legislative proviso. The Food Security Council involved members of each agency that administered federal nutrition programs or federal assistance programs, and the intent was to look at ways food insecurity and food access could be impacted. And 2 of the recommendations that I would like to highlight, and really, I think even some things that Chandler was just speaking about kind of get looped into this, but they are exploring essentially what's called a no wrong door application or eligibility system. So a centralized system for individuals who utilize public assistance programs to make it easier for them to be tied into multiple programs at one time, increasing access to those programs and utilization of those programs, but then also implementation and funding of the summer EBT program. So as a dietitian, I was in clinical practice, pediatric clinical practice throughout really the thick of the pandemic. And within the first few months of the pandemic, we were able to see in person just how much of an impact inadequate food access had on not only a pediatric patient, but really the family as a whole. And I think now that we're on the backside of the pandemic, it is very evident
I'll be in the bag.
Not only the economic impact, but the health impact that the pandemic really had, not not just in our state, but nationwide. And now we're really starting to, I would say in the public health space, just bring to the forefront how much hunger, poverty, equitability, how much they're tied together and the impact they have on the state of health of not only individuals, but our state as a whole. So with the no wrong door application or central application eligibility system, the intent of that is to take someone, for example, who might be applying for SNAP, and then all in one go, look at their financial stability or situation, assets, everything that goes into determining eligibility for assistance programs, and taking it one step further and saying, okay, you as an individual or family, or maybe just one of your family members is eligible for program A, B, and C. So we'll go ahead and get an application rolling on those programs. And if that is not something that you're familiar with, a really great example is DSS and Department of Ed. So during the pandemic, and I'm kind of touching on my next point, but during the pandemic, what was called Pandemic EBT was initiated and rolled out. And this was a program that took funds for individuals who, well, students who were eligible for free or reduced price lunch. And because those students were no longer in school, USDA took funds and loaded them onto for individuals who already received SNAP benefits. They received an additional allotment of assistance to recoup the free breakfast, free or reduced price breakfast and lunch that those children received at school. And then it also went another step and included children who maybe were not necessarily, we know at that point in time, we had exceptions for SNAP. So more than just our set of individuals receiving free and reduced price lunch received these benefits. Now, that's an example between DSS and Department of Ed, but we could take that a step further. And we know that not everyone who is eligible for assistance programs receive the benefits. There's something called the SNAP gap. So here in South Carolina, it's approximately 1 in 5 individuals who is eligible to receive SNAP services does not receive those services. And there are many number of reasons that an individual might not access the benefits they are able to or eligible to apply for. And that can be tenfold. It can be lack of awareness of the actual program or when eligibility can start. There might be barriers to like physically accessing a site to apply for those benefits. There's significant stigma surrounding these benefits. So inclusion within our state of a centralized application process can really reduce the amount of barriers that whether it's just one individual person or maybe it's an individual with a family. So barriers that they face to really apply to and access those services, which in turn, you know, will by default improve the access to food, reduce food insecurity. And what I was kind of touching on with what Chandler had touched on, it's very well established, the reciprocal relationship between food insecurity, physical health, the negative impact that has on mental health, and just kind of the ongoing circular input and output of those issues that they can have on a family. We know very, very well that children who experience food insecurity their educational attainment is impacted. But what is not necessarily always discussed is that it's not just educational attainment. So the term adverse childhood events is becoming more and more discussed. And one of the adverse childhood events that can impact, you know, the lifetime of a child and their overall mental health and physical health is the actual relationship that exists within the family. Caregivers who experience either financial hardships or In this food insecurity discussion, food insecure household, it's not just food insecurity that they're experiencing. Those households shift from purchasing medications, being able to pay rent, have adequate monetary funds for transportation, which in turn, impacts the ability to get to work, or it's just such an ongoing cycle of negativity that what has been experienced by children in the pandemic and in this recovery period, those will have lasting lifelong effects that those children will have to either attempt to recover from or won't recover from, dependent upon the support that exists within their town, county, state. So having the ability to have easier access to and easier enrollment in programs of assistance would greatly help to reduce not only barriers, but would improve long-term the actual physical health of the state of South Carolina. The other recommendation that has had a little bit more public awareness surrounding it is the implementation and funding of the summer EBT program. So as I had previously said, the pandemic EBT program, like during the actual pandemic, ending in summer of 23, took physical monetary funds and provided them to families of students who received free and reduced price lunch. Congress actually went forward and said this was such a profound program. Meal services during utilization of pandemic EBT funds increased 120% within one summer period. So historically, summer food service programs are underutilized. Again, it's a barrier thing. Parents work during the summer. When children go to school during the school year, they're dropped off at school. They're there for breakfast and lunch. There are a lot of regulations surrounding the summer food service program. In South Carolina, it's known as the Summer Break Cafe. Meals have to be served on site. Children have to physically be present for the entity to be reimbursed. The organization that provides that service has to be financially sound, has to have staff to provide that service. So the pandemic EBT really allowed families flexibility and funds to be able to replace the free and reduced price breakfast and lunch that was provided at school. About 62% of kids within South Carolina receive free and reduced price lunch. That's over 400,000 children. So when schools close during the summer, that is 2 meals those 400,000 children are no longer receiving unless they have access to a summer break cafe site. This year, it was the decision that South Carolina would not pursue this. States are required to provide 50% of the administrative fee to actually implement the program. Federally, 100% of the funds for the foods would come from the federal program. So as we move into the summer next legislative session, or have the ability to speak with decision makers, figuring out how we can support the children within our state and really roll out a program like this would truly impact not only that many children, but also reduce significant anxieties from families as well. So I think I went a little over, but thanks, Brooke.
No, that was great. Great information. Yeah. Thanks so much for that. Okay, so we did mental health, nutrition. We're going to roll into Christina for our social justice related topics. And that was Kate's contact info, and I'm sure we'll provide the slides and everything as well at the end, and can definitely get a hold of everybody. All right, Christina, you're up.
Okay. Hi, I'm Christina Picozzi. Again, I use she, they pronouns. I own a health coaching and a nonprofit consulting company, and then also I'm contracted with the Harriet Hancock LGBT Center. I'm also working on a master's in public health as well, which is how I have kind of fallen into this wonderful group of people. As you can see on the slide, I started kind of my journey in advocacy by writing letters and donating money, especially knowing how like my anxiety would show up when I was in public spaces. So for me, I always thought rallies and physically being present wasn't something that was possible until it ultimately was. And I started to give myself the opportunity to have those experiences to okay, I guess like reaffirm like this can be for me. This is meant for me. As Brooke said, I'm going to be talking a little bit about social justice. I'm primarily going to be talking about queer justice, but something I really want to I kind of emphasize is queer health is the same as it is for birthing people, and Black health is the same, and food insecurity. Like these issues are all of our issues. And so that is something you see here on this slide. So these are 4 pieces of legislation, and there's so much more. But these were 4 that I had been kind of following, that we had been kind of following with HHC. H4663, S332, and S585. Those 3 did not pass out of their committee. So those have all essentially died in committee. There were other iterations of these bills. And so I do think it is very important to kind of note that you might see 2, 3, 4, 7 iterations of a bill, both on the Senate and the House side. And language might be similar. Some language can be different. The one that I'm primarily going to be talking about today is H4624, which is called Gender Reassignment Procedures. However, we talk about this as gender affirming care ban. This is life-saving care. This is medically necessary care. And if you look at some of the other iterations of this bill, but other bills that had different numbers, both on the Senate and the House side, the ages were different. I think one of the earliest iterations of this specific bill, it said 26 years old. I think all of us in this room probably know that consent for medical care is 16. So now all of a sudden we are going to be starting to make decisions for adults. So the current iteration of this bill really targets our trans youth. And some of those ramifications of this bill could then ultimately impact our trans adults as well. But something I think is really important to note about this bill, and like I said, I'm going to be talking about, is this passed so quickly through the House side. So some notes that I have that I wanted to share with you are that this was introduced in the House on the 9th of this year. 49 people spoke at the hearing, 48 were against this bill, and 1 person was for it, and that single person was from out of the state. People that spoke were parents of trans kids, allies, and trans adults. Within 9 days, this bill had been introduced, went to a House committee, passed out of committee, and then went over to be introduced into the Senate. That is super, super fast. It was referred to the Senate Medical Affairs Committee on the same day as it had been introduced. And something I think is very important to note is that nobody on that committee has a medical degree. There's a ton of attorneys, there are folks that do communication, there's somebody who's a pastor on that, but nobody has a medical degree that works or that sits on that committee. We were very lucky that folks that spoke when this was introduced at the House, that they were able to share quality studies that show why gender affirming care is so important. All of that was ignored. After it was introduced at the full committee, it was referred to a subcommittee. And then that subcommittee met on February 14th, February 15th, and February 21st. And this was because we continued to run out the clock on these discussions. It is really, if you are going to be talking about this kind of care, or care really for anybody's body and taking autonomy away from them and their families, this deserves care and quality discussion. And so that is what happened on February 14th. We had packed the room, and so they essentially adjourned, and we met for the very next day. They had changed the time 2 to 3 times, changed the room location as well. And we packed the room again, and we heard them have a full discussion about going back and forth, nitpicking at different parts of the legislation. There had been some amendments discussed. And then finally on the 21st, it passed out of the subcommittee, went back to the full committee, and then passed again on the 29th from that full committee. It was then contested by a senator. And then this past Thursday, there was a motion made for special order for this to be pulled off of that contested list. And this is actually what we are going to be talking about tomorrow at the Senate. So on the agenda tomorrow, at least right now at noon in the Senate, this is going to be up for debate. there are a lot of folks that have a lot of ideas about this, especially when we talk about kids, right? When we talk about feeding kids and kids being homeless and mental health care for kids and this specifically, I think that makes people kind of jolt back a little bit. When I say that this bans medically necessary care, I mean that this care is affirming for that child, and affirming care looks so different. It could be the use of proper pronouns and acceptance of name. It could look like clothing. This bill specifically does talk about medical procedures as far as hormone use. However, something I really want to make very clear, this is not happening in South Carolina, but our legislators would love for us to believe that it is. So a lot of the rhetoric around this is happening, and it's not. Especially for our youth as they are trying to figure out themselves. I don't know how many of you had a wonderful time as a child, but there were definitely some traumatic moments that I had in trying to come out in middle school, and then come out again in high school when I changed buildings, and then come out again when I changed school district, and then come out again when I went to college, and then coming out again as an adult trying to date. Like, there is a lot that goes into how we decide to express ourselves and present ourselves to the world, and how we have, these experiences with different people. Something as simple as a name or clothing can be very impactful. This bill also makes life-saving healthcare more expensive and harder for adults. So we talk about what are the ramifications of something like this passed. While the language may be targeted for youth, what actually could be systemic after the fact? This also, what we're not talking about enough of, this has an amendment that forces teachers to out children to their parents. By doing that, you could risk a family that is not affirming, a family that is not accepting, having a really volatile reaction to their child. Uplift Outreach Center in Spartanburg works with LGBTQ youth, and they have a lot of great information regarding homelessness in youth in South Carolina. And the numbers are going up, but one of the reasons why we see homeless youth that are LGBTQ is often to do with their gender identity and how they express themselves. Nobody, regardless of their age, who is insured through the state's Medicaid program, will be able to pay for gender affirming care. So again, the language talks about kids, but those ramifications, it actually impacts adults. The bill also prohibits public funding from being used either directly or indirectly from affirming care, and there's no age specification, which means people who are insured through the state healthcare plan may also be forced to pay these expenses out of pocket, and providers who receive public funds may also be intimidated away from offering this care. So think of MUSC as a facility. They receive public funds. This is something that we could see that facility, those providers may start to slowly stop doing, not just for obviously youth, but for adults as well. The ban also challenges best practices in healthcare, and we talked to the pediatric associations, medical licensing boards. This goes against what they're supposed to be practicing. And it also would force these providers to be reported to their licensing agencies, and this would be considered unprofessional conduct if they are doing gender affirming care on youth. I would say ultimately a lot of the conversation we're also having, and I think we've heard this conversation with abortion, as well as other medical procedures. This is a healthcare decision. This is not something that is taken lightly. This is something that is talked about among families and mental health practitioners and medical doctors. And this is not something that is quick to be made within a month or two. This is, for some folks, years long. And this is saying that some children deserve care. Some children deserve access, and some families and some adults, some parents are better at making those healthcare decisions for their children. And so while there are so many reasons that we are vehemently against this, I would say this is really saying who actually deserves care. So tomorrow we are actually there. Our organization is a part of a few different coalitions. One is SC United for Equality and Justice. This is a coalition of about a dozen or so different organizations that are doing social justice work. And we are actually planning a protest of sorts at the State House tomorrow. So I will actually be at the State House in the lobby, hopefully pulling out some of my senators to talk, some of the senators to chat. But we also are encouraging folks to come with signs and be heard. Allies are very important to us as well. We wouldn't be able to do so much work without allyship. So, but this is something that we are going to be in full force tomorrow.
Thanks, Christina. I really appreciate all your information. I definitely like just in general, just hearing the three of you, I think there was just like a lack of awareness, I think, when I came into this space. And that's so the more conversation I have with Christina, I'm like, I didn't even know this was out there and something that's being voted on, being discussed. So it's just like making yourself aware of all the things, I think, is kind of like step one, maybe, to kind of like stepping into it. So we have about 15 minutes left. I would love for you all on the call with us to ask any questions you have. I have some if we needed any prompts for our panelists, but I figured you all listening to the three of them kind of talking about mental health and nutrition and social justice related, I'm assuming you probably have some burning questions out there. You are welcome to come off mute and ask. You're also welcome to put anything in the chat if that works better for you as well, and I can check that and read those. But we would love to have any questions that you all have.
Well, I guess as a panelist, I'm curious. So I have gone to the State House a few times, and I've actually pulled both my representative and my senator out of the chamber. And I guess I'm curious, is there anybody in this room who knew that they were allowed to do that? And if so, has anybody actually done that other than me?
I have done that many times. And for those of you that don't know, there are like little QR codes around, and you can scan them and say like, hey, I'm your constituent and I'm in the lobby, and they will come out and actually talk to you. And that can be the magic words when you're talking to a legislator or constituent. I am your constituent. I vote, if you can say or not say. So that can be a really powerful advocacy tool for sure. I also want to say to what Christina was saying, they're not all bad. There are some good apples. There are some allies in our state legislature, but in the wrong hands, it is the largest scale abuse of power happening right before our eyes, and just the way that that bill just flew through the legislature, even in the face of so much evidence. And even Christina, you probably remember one of the senators actually said in the hearing, and they're all recorded. She said, I know this is not happening, but my constituents think it is, so I'm going to support this. And so rampant misinformation, all the evidence, and it just, it's only them voting on their opinion.
Yep. So that was Senator Sen. She is down in Charleston. And I think something that's also really important to note, we know who's being primaried and we know why they are saying what they are saying. And that is something that I think is very important too. So I have actually led folks into the State House to then pull out their senators. Something that I always encourage people to do is like, this is super scary. Wear comfortable clothes. Make sure you have your water. Make sure you have read your legislator's profile. What are they interested in? What committees do they sit on? How do they like to vote? If you can't tell, I'm a little bit left leaning. That means that the majority of folks I'm going to be talking to are not going to be ideological aligned with me. Not inherently. I will say I'm very lucky that my senator, Katrina Shealy, actually is very aligned with a lot of the things that I believe in, and not just nutritionally. If you guys have seen any of the work that she's done for nutrition and for kids, or what she's been trying to accomplish, but there's actually a lot of like, I've had conversations with her about this bill specifically, and I think she is mortified when we have talked about it, especially again those consequences of what are we going to do to protect kids that might be in harmful households, right? So there are definitely allies, but it's get to know your legislator so you can have a conversation to really meet them where they are. It's okay to have strong feelings. It's okay to use a little bit strong language, but thanking those who are being supportive and challenging those who are not. And I think recognizing who is being primaried and who might be being challenged in that seat, and how that might show up in their voting. Because I was told to my face on Thursday, if I decide to vote for this, it's not that I don't like you, but also I have to. And I would argue you don't have to, but you are choosing to, and you're choosing to because there is something else going on.
We got a question in the chat. Are there any groups that provide transparency on the legislators' voting record and how it aligns with their constituents and their views?
Not that I'm aware of. You guys might know more. Their voting record is all online. You can look up how they voted on every single piece of legislation. If they chose not to vote, going back, I think the database goes back pretty far. There are backroom deals that happen, so we take that with a grain of salt.
Mm-hmm. Yeah, great question.
Yeah, I was gonna say I agree with Chandler. There's none that I'm aware of, but it is on the state's website. I will say the website's a bit fun to navigate. It's a little outdated. But all of that information is on the website for you to search through different databases.
Perfect, thanks. Any other questions? Let's see.
I
Yep.
would also say another good way to know how your legislator is going to vote is to look at their donors. Who are their primary donors?
Let's see. Oh, I don't think I scrolled down. The other part of asking about that was this person was reading about how the voters view nationally only align 30% of the time. And then another question regarding the recommendation for implementation and funding of summer EBT. Can you clarify who makes that decision? Who's on the Food Security Council as well?
Yeah, well, so the Food Security Council is no longer together. It was part of the proviso to establish this council, and it was truly representatives from each agency that are implementing the program. So Department of Aging, DHEC, DSS, and there are a plethora of assistance programs that are implemented within the state. I think the USDA's Food and Nutrition Service has 16 or 17 programs that provide nutrition assistance. But so that council is no longer together. It was truly put together to quickly study and then provide recommendation. But who would make the decision regarding implementing that? And it would need to be the governor would have to agree. So part of it is that the agencies who administer the program need to have adequate funding to provide that service. 50% of the administrative cost has to come from the states, and that's the only cost. But we have to have money then from the budget to do so, and then also adequate staffing within the agencies to do so. So there's a lot that needs to be put into play to implement that, but ultimately it's between DSS and Department of Education to be able to data share of who would be eligible, and then the actual implementation of those funds would likely come out of DSS. So that's a legislative piece.
Mm-hmm. Yeah. Thanks, Kate.
Yeah.
I'd say my question to you guys is like, where do you start? You know, for anybody who may be on this call who is just interested in hearing more about, you know, what is happening with these topics, and like where do you start? What do you do? What would your advice be to them on how to like get out there and get involved?
It's always easier to advocate for something you're passionate about, but I think ultimately is the awareness of the impact that this has within our state for any of the discussion points of today. So who's truly being impacted? What are those numbers? What is the long-term outcome that can happen? The decisions we make today are impacting our future, and the future meaning our children that will be running the state. So, you know, what do we want our state to look like in 1, 2, 3, 4, 5 years? Yes, but what about 10 years down the road? It's unknown what, you know, the long-term impact of COVID is going to be.
Mm-hmm.
It's no different than in the 1930s with the Great Depression and the Dust Bowl, and which spurred the implementation of, SNAP or food assistance. But it's, what are you truly passionate about, and what impact can it make within the state?
Mhm. Thanks, Kate. Chandler, Christina, would you add anything?
I agree completely with what Kate said.
I'd say that regardless of the issue, this is all still an emotional labor that we are all taking. When you're invested, when you have had a negative interaction with a legislator, there's so much. And so I'd say also think of like your capacity. What is that first step? Little plug, we are hosting a voter registration and advocacy 101 event at the Harriet Hancock Center. We're in the Melrose neighborhood this Thursday from 6 to 8. Free pizza. If you are registered to vote, you're going to learn a little bit more about what that looks like for you next step. So we're going to talk about how to find your legislators. We're going to talk about how to actually go through that process to figure out what do they care about? How could you have a conversation if you wanted to have a conversation? How could you write a letter? What should you include in a letter if you were interested in that? As well as just like the importance of voting. And then if you're not registered, we're going to help you get registered. And I will say, ultimately, I do not care what party you are affiliated. I want you to vote. Our big push is that 18 to 24 year old person. In South Carolina, 41% of that age group in the last general election was registered to vote. And then of that 41%, I think 2/3 voted. And this is also how do we look at other age groups and make sure that they are voting. And so I would say if voting is your first step, be educated in that voting process. Do not just toe your party line. Make sure you know what your legislator stands for. South Carolina is a super fun state where things do not go to ballot as citizens. We do not get to vote on things. We vote folks into office and then they get to vote for us, which kind of sucks sometimes. So I would say be educated about what your legislators stand for. I think that, so I'd say if voting is your first step, be educated. Be as educated as you possibly can. And if you say, well, I am ready to make an next step, send them an email. Can you send a letter? Can you send that email? If you feel like, you know what, I can do more, donate your money to organizations doing this really good work. We need money. A lot of organizations need money to be able to continue to do the work. And then, do you feel like you can take some time and go to the State House? It is tough going to the State House during a workday, and I totally respect and understand that. If I was not in this position, I would not be there as much as I am. But if you ever feel like you can take a day off and do that, do that. REN, so the Women's Rights and Empowerment Network, they do work for women and gender expansive folks. They host a Meet Me at the State House a couple times a month, typically during the legislative cycle, which is only January to May, right? That's something to also note, January to May. But like, I think you should look at what are those steps for you as an individual. Where do you feel comfortable and where do you feel like you're able to push yourself to go into that next step?
That's great. Thanks, Christina. Looks like there's one last question in the chat. Are there any lobbyists that are supporting these kind of efforts? I know we're talking about advocacy, but I just wanted to know.
I think there are a lot more lobbyists in the education part of our world. And that, a lot of it overlaps, like Kate was saying, we have a lot of overlap in what we do. And so I think lobbyists are a little bit more accessible in that space. SCCA is a 501c3, so we can't really do a lot of that, which is why, us working in the field are doing that. But education might be a better avenue for that.
Great, thanks. I think we are pretty much about at time. Were there any last questions? Appreciate the comments in the chat and the questions and some positive shout outs to you all. Great information. Thanks. Upcoming for SCPHA, they are wanting to focus more on advocacy moving forward. So they're planning a workshop later this year, Tuesday, October 8th. There will be a lot more details to come. They're still in the planning stages. But just keep that on your radar. And also, like, if advocacy is a big interest and passion for you, you are welcome to reach out to me as a point of contact. If you are wanting to get involved with SCPHA and advocacy, I can help link you up with the folks. I think they're trying to expand and have a committee of people to help with these efforts. So greatly appreciate my panelists that I roped into this. Y'all are fantastic. I really, really enjoyed it. Again, it's just having that awareness and like knowing what's out there and what you can possibly do. And I think people get overwhelmed and they're not sure where to start. So I hope this was really helpful with kind of giving you probably a little vote of confidence too, that you can get out there and do this, and just knowing of all the things and how they overlap, how each one of the panelists, they were overlapping with each other with what they were talking about and the needs and concerns. So I greatly appreciate my panelists. Thanks to y'all for attending. Don't forget, there is one at 1:30. So if you're interested in opioids, the lovely Elizabeth DeMeo with DHEC is going to be delivering that presentation at 1:30. Register for that one. I double checked my link. It did look like it did include the passcode. So if you did register for this next one, I think you should be good. I think there's the passcode included. So sorry for the technical difficulties, but y'all are welcome to email me with anything of interest with SCPHA advocacy. If you need contact info for these lovely ladies, happy to connect everybody. Thanks so much. Appreciate it.